The employee has been asked to self-quarantine, and we have identified all the staff members and patients that may have come in contact with this individual. Over the next few days, these persons will all be contacted to ensure that they are well and to ask them to self-quarantine if they are asymptomatic. If they have symptoms such as fevers, a shortness of breath, sore throat, cough, then they should seek care with their primary health care provider, and they will be tested if needed. As far as the number of tests being performed, that is dynamic, always changing, so I can't give you the exact up-to-date numbers. However, as of Friday, our public health lab had performed over 60 tests, and now we also have commercial labs, Quest and LabCorp, and we do not know exactly how many tests they're performing. However, I've been in communication with the commercial labs, and we're planning to set into place probably twice weekly reporting from them of all tests that are being performed, not just positives, but everyone. We've maintained all along that it's not a matter of if we would see this community transmission, but when we would see this community transmission. And we've been preparing all along for this scenario. Our planning has involved implementation of our robust disease control interventions, and we're confident that our disease control mitigation strategies, along with the guidance that we issued last Friday to postpone or cancel mass gatherings, visitor restrictions to long-term care facilities, social distancing measures for our local schools, are all factors that will allow us to bend and flatten the curve on the impact of the virus in our community.
We know that this is a time of uncertainty, and it will most certainly escalate the feelings of stress and anxiety, maybe even depression for some people who are, especially those who are self-isolating. These are normal responses, and it's important now more than ever to remember to do what we can. Take deep breaths.
Students are being socially distanced, and therefore we will help break the cycle and flatten the curve. There are no identified cases for schools at this time. However, we are encouraging schools to do their part to mitigate the spread of the virus.